Hello everyone. Today we are here to discuss about our problem statement. A wheelchair having oxygen cylinders for COPD patients.
Now we look at our problem description. What is COPD? COPD is chronic obstructive pulmonary disease. It is a type of progressive lung disease characterized by long-term respiratory symptoms and airflow limitation. COPD and asthma may coexist and converge in some individuals. COPD is mainly caused by smoking and asthma is caused by allergies. The main symptoms of COPD include shortness of breath and a cough, which may or may not produce mucus. COPD progressively worsens with everyday activities such as walking or dressing becoming difficult. While COPD is incurable, it is preventable and also treatable. What causes COPD? Smoking, pollution, occupational exposure, and genetics. These can be prevented by smoking cessation, occupational health, and pollution control. Hypoxia and hypoxemia are harmful effects of COPD. Hypoxemia is a below normal level of oxygen in your blood, specifically in the arteries. Hypoxemia is a sign of a problem related to breathing or circulation. Hypoxia is one of the harmful effects of COPD when not enough oxygen moves around the body, impacting organ function. The main effect of hypoxia and hypoxemia is having low level of oxygen in blood to maintain oxygen level. We usually carry a oxygen container along with the wheelchair. As a patient with COPD, the need for supplemental oxygen therapy can greatly impact one's daily life. It can be difficult to move around and complete tasks when constantly tethered to an oxygen tank or concentrator. A wheelchair with an attachment for B-type oxygen cylinder can provide more mobility and freedom, but it can also bring about traditional challenges.
Now let us look at some facts and stats. Female smokers are 50% more likely to develop COPD than men. COPD causes an economic loss of around 13.4 US billion dollars in India annually. More than 20% of the cases annually are reported in India. COPD is affecting almost 20 million people in India. Death rate is 64.7% among every 100,000 patients, including both sexes. B-type oxygen cylinder can equip up to 1500 liters of oxygen. If used continuously at 2 liters per minute, this cylinder will last for minimum 7 hours. Let us discuss different perspectives of understanding user. Customer perspective. From a customer perspective, the problem is that COPD patients who require oxygen therapy often face mobility challenge who use an oxygen cylinder. Traditionally, oxygen cylinders are heavy, bulk, and difficult to maneuver, which can make it hard for COPD patients to move around freely and engage in daily activities. Additionally, COPD patients require a continuous supply of oxygen, which means that they need to carry their oxygen cylinders with them wherever they go. Healthcare perspective. From a healthcare perspective, the problem is that managed COPD can be costly, and many individuals may struggle to access the care and resources that they need to manage their symptoms effectively. Providing an attachment for a wheelchair that allowed for safety and easy transport of an oxygen cylinder could help to improve quality of life for individuals with COPD, while also reduce the healthcare cost associated with hospital admissions and emergency rooms visits. Overall, the problem of providing a wheelchair attachment for an oxygen cylinder from a customer perspective highlights the challenges that individuals with COPD face on a daily basis and the need for innovative solutions that can improve quality of life and reduce healthcare costs. Technological perspective. From a technological perspective, the development of a wheelchair with an attachment for a B-type oxygen cylinder would require careful engineering to ensure that the wheelchair is stable and safety to use. The attachment would need to design in a such a way as to allow
for easy access to the oxygen cylinder, while also ensuring that the cylinder remains securely in place. Medical perspective. From a medical perspective, COPD and chronic respiratory medical perspective. From a medical perspective, COPD is an chronic respiratory disease that affects millions of people worldwide. It causes the airways in the lungs to become inflamed, make it difficult to breathe. Many COPD patients require oxygen therapy to help them breathing more easily. Oxygen therapy can be provided in a variety of ways, including through an oxygen cylinders, which can be cumbersome for patients to carry around. Societal perspective. From a societal perspective, providing COPD patients with an wheelchair with an attachment for an oxygen cylinder could improve their quality of life and help them to be more independent. Additionally, reducing the burden of carrying an oxygen cylinder could encourage many patients to seek treatment for COPD, which can ultimately lead to better health outcomes for the population as a whole. Safety perspective. Another perspective could be the safety concern associated with using wheelchair with attachment oxygen cylinder. Customers may worry about stability and balancing of wheelchair, particularly when navigating uneven terrains or encountering obstacles. There may also be concern around properly securing the oxygen cylinders to prevent it from falling or become an hazard in case of an accident. From a broader perspective, the problem is that COPD and chronic disease that affect millions of individuals worldwide, and the burden of managing symptoms can be significant. In addition to physical toll that COPD take on the body, it can also emotionally and socially challenging, especially when mobility and independence are compromised.
In conclusion, the problem of mobility challenges faced by COPD patients who require oxygen therapy is complex and multifaceted. A wheelchair with an attachment for a B-type oxygen cylinder could be a potential solution that addresses the needs of COPD patients from different perspectives. However, the cost and design of such a solution need to be carefully considered to ensure that it is accessible and safe for all patients. From a particular standpoint, customers may also face challenges with finding compatible oxygen cylinder holders or bags that fit their specific wheelchair and B-type cylinder. This could require additional research and investment in finding the right equipment, which could add to the cost and time involved in setting up the system. Overall, the need for a wheelchair with an attached oxygen cylinder can be both liberating and challenging for customers with COPD. Understanding the various perspectives and challenges involved can help providers and manufacturers develop solutions that are safe, effective, and practical for the diverse needs of customers. Thank you.